My name is Nadia Mohammed. I'm a third-year medical student at IUHS School of Medicine. Today I'm going to be talking about the appropriate uses of medications in psychiatry. As physicians, it's, I guess, we're stereotyped as using medications as the be-all, end-all, but it's important to note that, especially in psychiatry, medications should not be used alone, and that should be considered a golden rule in medicine in general, but in psychiatry especially, where psychosocial and behavioral therapies and counseling is used in conjunction and probably the best way to achieve a lasting result. Before a physician should even consider using any type of medications in psychiatry, they should first have a proper diagnostic evaluation done on the patient. So that includes things like a physical exam, where you actually have to touch the patient, a psychological exam or evaluation, which may include things like an IQ test, depression screening, concentration, memory tests, things in that nature, which will give the physician basically a baseline for that particular patient. What's also important, since we're talking about baselines, is laboratory baselines. So things like CBC, which is very important with differential, a CMP, comprehensive metabolic panel, lipid panel, fasting glucose if necessary, TSH, vitamins B6, 12, and vitamin D. For children especially, you'd want to have lead levels. Basically, we're doing all these laboratory examinations or tests to make sure and rule out any underlying general medical conditions. Things like an elevated TSH or a decreased TSH can affect a person's mood, whether it's irritable, whether they're irritable or depressed. We can often figure it out if there's a chemical imbalance. The next thing you might want to consider doing as your diagnostic evaluation continues is an ECG and EEG or other specialty consults if they're applicable. Again, we just want to rule out any other general medical conditions that might be affecting this person's psychological well-being. So basically everyone knows, physicians know this, general public knows, medications have both beneficial and adverse side effects that will range from just annoying to very serious. So you'll have maybe with a certain serotonin blocker, you'll have a serotonin reuptake inhibitor, will have sleepiness, and then you'll have something along the lines of extrapyramidal syndrome with antipsychotic atypicals. So the way a person's affected depends on the metabolism of that individual, so that's why baseline is good to have. So some possible indications where a physician or psychiatrist will use a medication would be things like ADHD, OCD, depression, anxiety disorders, sleep disorders, bipolar, psychosis, autism, severe aggression, or eating disorders. Now, as Dr. Martinez has already said, everyone can use a little bit of counseling, but not everyone requires medication. So what constitutes using medication and what doesn't? We are, as physicians, employed to know how a patient wants to lead their own life, not exactly what's expected by society, but as what that person individually wants. So if the patient's life has been affected negatively by this particular disorder, if they're not able to do their regular daily things, if they're not able to go to work, not able to go to school, if they're not able to dress themselves on their own, that is an indication for medication. If this person is a threat to themselves or others, that's another indication for using medications. Obviously, there's a biochemical imbalance. You're going to want to fix that balance with medications. And if the medications have a way of increasing the patient's well-being, and as an individual, but also in society, that's when you should consider using medications. So there are oftentimes abusive medications in psychiatry, so the rule of thumb is to start low and then titrate up, just to be sure you don't face complications. So, any questions? No? Okay, so